So this is for anyone who isn't able to attend live. We can actually send this out in the email that we send at the end of this event for anyone who registered. So welcome everyone. My name is Rachel McGill. I am the Healthcare Workforce Liaison for JMG. My position is a partnership with MaineHealth, and my job is really to build knowledge and increase an awareness around healthcare careers and training programs that MaineHealth offers. So today I'm super excited to kick off a third one in our series now, which we're calling MaineHealth Monthly Mondays. And in these webinar series, we're talking about a different career opportunity or training program. And the structure of today's conversation, just so you guys know, there will be a couple of poll questions that pop up, and we're actually going to start a conversation with a poll question. These are anonymously responded to, so please don't feel any pressure. It's really just for us to gauge what you guys know out there, those who are attending this webinar live. If you have questions that pop up throughout this presentation, please use the Q&A section. We've allotted some time at the end to kind of address any questions that pop up. So please don't hesitate to kind of put your thoughts in that Q&A. And then finally, there will be a survey that pops up at the end of the webinar, 3 questions. And if you do have time to kind of respond and give us some feedback, we use that as we're doing future programming. So we greatly appreciate that response. All right, so now that all the housekeeping items are done, I'd love to introduce my wonderful guest today. First, we have Brenda Buck, who's the program manager for the School of Surgical Technology. And then we have Lynn Frist, who is a faculty member in the program. And Lynn actually holds a couple different credentials right now. So she is a CST, which is a certified surgical technologist. So this is the program that we're talking about today. She also has an RN, so she's a registered nurse, and a BSN. So she has a Bachelor of Science in Nursing. So we talked about this just before we got started, just the acronyms and credentials that we are kind of used to working in the healthcare industry, but students may not be aware of what those things are. So we're put that in the Q&A if we say an acronym that you might not understand. All right, so let's start with our first poll question. So just to get a sense of what we have sitting out there, do you know what a surgical technologist does? So if you guys have I'll give you guys about 20 seconds to respond, and then we'll kind of see the results. Looks like we're about 50% through. I know some of you might be full classrooms attending, so you may be debating on what your answer is, or it may be split. So we will end the poll now and share the results. Okay, so no one answered that they know what a surgical technologist does. There's some that somewhat know, and most people who don't know. So this is really good. So I'm gonna stop sharing. So that's actually my first question to you all. What is a surgical technologist? And if you could talk about, maybe even like take us through a day in the life, what kind of tasks do they perform? What settings do they work in? And who do they interact with most within the healthcare field? And that could go to either Brenda or Lynn.
So I'll just start, Lynn, with a very brief overview. So I want the audience to understand that, you are a surgical technologist, right? But the program itself is to train you to be in the operating room and be responsible for patient care, the sterility of the operating room field within that operating room team, and the instrumentation that is handed off to the surgeon that is involved with that procedure. Now, Lynn is going to be able to handle the more in-depth medical side of this. So if you could just keep in mind that the 2 main job responsibilities of a surg tech is patient care and instrumentation, and Lynn's going to walk you down to a place where it gets in much more detail.
So so there's a lot of different responsibilities that you have when you're a surgical technologist. One of them is being that you're working in a team. It's a very team-centered environment. And so you are a very important piece to the care of a surgical patient. So a typical day would be you arriving into your operating room. You would be looking through a pick list, which has basically everything that you need for the surgery on it. You would go through that list, you would pick your suture, you would make sure you have all of your equipment. You would go out and scrub, which is a big thing. So you do a surgical hand scrub to prepare yourself for surgery. And then after that, you would go in, you'd gown and glove, and then you would start to set up your sterile field. You'd be working with your circulating nurse who is in the room to help you out. You would do counts together. You would make sure that you have all of your items together, and then you would wait for the patient to arrive. Once the patient comes in, they go to sleep with anesthesia, and then you will help to drape the patient out, and you will do your procedure or your surgical procedure with the surgeon. So you could be working with the surgeon and a PA or resident, and you'll be actually at the sterile field, handing the instrumentation, just as Brenda said, in a sterile fashion to a surgeon who's going to be doing surgery on the patient. Once that's done, you're responsible to make sure that you have all of your instrumentation back. We don't want to leave anything behind. So you're going to do counts. You're going to work with your nurse on that. You're going to help clean up the room. You're going to help take care of the patient. You might even help bring the patient over to recovery. And then you're going to get rid of all of that stuff. You're going to clean up your room, and you're going to start all over again for your next procedure. And so they can be really long days, but they're really exciting days because you never know what you're going to see. You see all sorts of crazy things, which is kind of cool.
So Lynn, if I could just add to that, from I'm a business manager, not a medical person. So I think it's important that everybody really hears what you just said there, because if they're still discerning what specialty they want to do, what Lynn said is important to note. This patient is under anesthesia, right? So this would not be a patient where you're going to have a chat with, or you're going to talk about what's happening and what's not happening. This patient is asleep. And a lot of people will get into the operating room. I think maybe nurses might realize this, that they either want to deal with a patient that they can talk to and interact, or they would rather be in like a post-op recovery or an operating room nurse. You can tell me if I'm off track with that a little bit, Lynn, but I think it's important for people to understand that this patient is not awake.
This patient is not awake, so it's not like you're going to be able to have conversations with them. So basically, one of the biggest things you need to remember is you're advocating for your patient. Everybody is in that room to take care of that one person. There's usually like 6 or 7 people. Some of them come and go, but we're all in there to take care of that person. They cannot speak for themselves, so we need to be able to stand up and speak for them if we think that something might not be going well, or if we think something's wrong.
That's a really great point to bring up, that you are kind of just as important of a team member in that OR as sometimes even the physician who's doing the procedure. So I love hearing that take. And Lynn, do you mind talking about the different settings that you could work in? So you mentioned not really knowing what's coming through the door. So I imagine like that could be like an ER setting versus maybe some of the other like outpatient settings that you could potentially work in as a CST.
Sure. So there's a couple of different places that you can work once you become a certified surgical technologist. Obviously, you can work in a facility like Maine Medical Center or Scarborough Surgery Center. That's a day surgery place. You can also work in much smaller facilities. You can work in dental office. You can actually work in a veterinary clinic. You could work for an organ procurement team. You can work in a podiatrist office. You could work pretty much anything where there's any kind of medical work that's to be done. Maybe where we have to sterilize things. You could work in a dental office as a sterilizing technician, as a processing technician. So there's lots of different options that you have when you become a surgical tech. You don't just have to work in a hospital. You have lots of different places that you can go to where your credentialing will help. You could also work in SPD, which is our sterile processing department. So you can work with instrumentation, cleaning it, wrapping it, preparing it for surgery. That's a really big undertaking. There's a lot of knowledge that's required to be able to do those positions. Or you can just say, I want to come work at a level 1 trauma center, which is what MaineMed is, the only one in the state.
So Lynn, what would be the difference, say, between taking a job working for like a plastic surgeon or a facility that just does day surgery, like, carpal tunnel procedures, putting tubes in kids' ears, shoulders and knees, versus what you might encounter at like Maine Medical Center on any given day?
So what makes Maine Medical Center a little bit different than, say, like your plastic in hand or like dental offices? we do a variety of different types of procedures. So we do procedures on lots of different types of patients. We have critically sick patients or critical acute patients. We have patients that come in that day and they go home that night. And we do all sorts of things. We can do cardiac surgery, neurosurgery, pediatric surgery, general surgery, which is like belly stuff, orthopedics, which could be like broken bones or like total hips and total shoulders. So that's what we do here. We do a lot of different stuff here. At some place that's a little bit smaller, like a day surgery center, which would be like Scarborough, they do a lot of the same thing every day. They're more generalists. So they do like total joints. They do myringotomy tubes. They put tubes in little kids' ears to help them, to help them with ear infections and things like that. But it's very consistent. The patients that come to smaller surgery center type places are very stable patients. They're not usually critically ill. And so they're considered what you would consider like, quote unquote, the walking well. So they come in that morning, they have their procedure, they stay for a little bit to recover, and then they go home that day. Some of the patients that we deal with at Maine Medical Center are not able to go home that day because they need more care. And so we're dealing with a different type, a more dependent patient, if you will. Working at a place that's even smaller, say like a plastic surgery place, that's really cool too. It's day surgery, but the difference is it's kind of the same thing every time. So it's only stuff in plastic surgery. So breast augmentation and liposuction and maybe an abdominoplasty or like lipoplasty and maybe some skin stuff, things like that. So it kind of depends on what you're looking for. If you want like high excitement, you want to be challenged, then maybe working in like a level 1 trauma center or bigger facility might kind of float your boat. But if you're looking for something you get to do a little bit of everything, but you don't want to like be bored per se, then maybe a surgery center would be someplace that would be good for you because you still get to do variety of different types of procedures.
That's great insight too. A lot of the students working through their curriculum for JMG will kind of do those career assessments to find out, what cluster they might be interested in studying under, but then it's also assessing how you like to work. So do you like fast paced? Do you like more variety, or do you kind of want more of like a set schedule? Exactly kind of what your day is going to look like, what you're going to be doing within a degree of,
Yes.
I know healthcare can, things can change last minute, but still. So that's a really good point, Lynn. Thanks for bringing that up, and Brenda too for kind of pointing that out. So Lynn, we're keeping you in the hot seat just because I think it'd be great to hear your story of, did you always know you wanted to work in healthcare? Because obviously you're a certified surgical technologist, but you also have your bachelor's degree in nursing. So could you talk about like what your journey has been like?
Sure. So when I first started looking into surgical technology, I didn't know what it was. So I had to look it up. And then I was like, oh, you get to work in the operating room. That's kind of cool. I was just like, I don't know how I'm going to feel about it. But I decided to go into the program, and it was a full year. It was very fast paced. It was very busy. Didn't have a lot of free time. I felt like all I did was study the entire full year. But when I graduated, finally, I started working at Maine Medical Center. And it was one of those things where I was still, even after I graduated, even after I passed my test, I was still like, I don't know if I want to do this, because it was kind of scary at times because it was a very fast paced environment. But as time has gone on, I really enjoyed what I was doing. And I really liked being on the shift that I was on, which was evening. So I did a lot of the faster paced, higher energy procedures. So I did like car accidents and emergencies and, all sorts of things like that. So I was always kind of busy and was always kind of running around, and I really enjoyed it. And I kept doing it. But after a while, I decided that I wanted to do a little something more. I wanted some more responsibility. And so that's when I decided to go to nursing school. And one of the great things about having gone to surgical technology school first was it afforded me the opportunity to kind of see what was out there. So I got into a medical facility, which was Maine Medical Center, and I worked here until I figured out what it was that I wanted to do. I was still kind of on the fence about being in medicine, but being in the operating room allowed me to see, like, what was it like to be a circulating nurse? What was it like to be a PA? What was it like to be in medical school? I got to see all of these things going on while I was working. So I decided that the best fit for me would be go to nursing school, and which is what I did. So after I graduated from nursing school, I continued with Maine Medical Center, and I stayed in the operating room, and I worked as a circulating nurse in the operating room. The best thing about that for me was I got to scrub too, because I still had those skills. So I got to go back and forth between scrubbing and circulating. So it was kind of nice. So I kind of kept up on my skills. And then after a while of working in the operating room as a circulating nurse, I decided I wanted to try something a little bit different. So I went into wound care. And so my patients were awake, which was a real change for me. And I really enjoyed it, but I stayed in the operating room still, and I kept working on the weekends because I couldn't leave the OR. And eventually the opportunity presented itself to work as an instructor at the School of Surgical Technology. And I felt like this would be a great fit for me because I wanted to go into education. I wasn't really sure how to do it, but knowing that I can teach people what I know about surgical technology and kind of pass on that information is really nice, because I'm teaching people all the stuff that I've learned to try to help you navigate through your first couple of years of working on your own. So it was kind of a long and varied process.
No, that's fantastic. And it's a lot of what we kind of talk about. You may not know exactly what you want to do, and maybe this is just how you get started in a training program. And you have kind of informal networking opportunities once you're in healthcare working in a facility, and you can see what some of those other specialty areas and talk to those folks who are doing those jobs. So I think hearing that that's kind of what you did, Lynn, really helps affirm some of that the opportunity that this would afford. Okay, so we talked about what a surgical technologist is. We heard a little bit about Lynn's story. Now, I think it probably makes sense to talk about the training program. So how do you become a surgical technologist? So we're kind of looking at, I think, Lynn, you said you graduated from this program. This was a year-long training program. So maybe Lynn or Brenda actually could talk about the structure of what that year might look like, what that program looks like in the classroom versus clinical time.
So Lynn, why don't you talk about your experience as a student? Because I think it's much more interesting to talk about what the content is and what the expectations are in an accelerated year of study like we present. And then I can kind of talk about, how to apply in the admissions piece and that sort of stuff. Okay.
Okay. So one of the things that I remember most vividly when I was going through the program as a student was the amount of reading that I had to do. So I was doing about 4 to 5 hours of homework a night on top of studying for my tests and exams and quizzes the following day. So it was a very intensive program. If you haven't experienced an accelerated program, it's definitely very eye-opening, but it takes up a lot of your time. So it makes it difficult for you to maybe go out on the weekends with your friends because you have a huge anatomy test, usually on Monday. So you really have to be willing to sacrifice the time to study. One of the things that I remember having discussions with my closest friends was how, even though they weren't really in school with me at the time, they were going to school with me. They just weren't taking the tests. But I was obsessed with just trying to learn all of the information. It's a ton of stuff. And because we do it in such a shortened period of time, it doesn't really leave you a lot of time for like free time after school, because you're in school for about 8 hours, then you're studying and you're doing your homework for 4 to 5 hours, and then you have to study and prepare for your tests the next day. And then, so it's a lot. It's a lot. And
that's just the first 6 months, right, Lynn?
That's just the first
then
6 months.
we send you out to our affiliates to these operating rooms that she was just describing earlier, where you're part of the operating room team as a student. You can find yourself standing in an operating room, scrubbed in 3 months into this program. And that's why there's such a data dump, so to speak, as far as the didactic piece is concerned. Why we're really trying to get you that knowledge base so that you're ready to be standing there and qualified to be standing there. But it is not a traditional college experience at all. I'll just jump off here for a second and go down the road of, there are opportunities to take a 2-year associate's degree, surgical technology, degree program at other institutions or other universities. But the one that's offered at Southern Maine Community College with the workforce development team helping us is the one that is basically made up of the accelerated portion with Maine Medical Center. So the college looks at Maine Medical Center's piece of this associate's degree program, if that's what you choose to do, as 45 credits towards their degree. Or you could just do the 11 months with Maine Medical Center, have that credential and go right to work. So there are some choices, but the one thing we want to impress upon everybody today is that there right now in Southern Maine, there's not another choice as far as just this accelerated 1 year of study. It's a different type of commitment than just going to college.
Yeah, I'm hearing highly motivated students, hearing, being fully buying into this, and kind of having to keep that end goal in mind. It's 1 year of intense study and clinical time, but at the end of that, you are certified and you are out, employable and employable, putting those skills to work right away.
The job itself is in such high demand, Rachel, that a lot of people right now are choosing to go through our program, whether they're fresh out of high school, whether they're here at SMCC and have kind of been tossing and turning about what they really want to do, or whether they're been laid off from some industry and now they're looking for a second career, maybe something a little more meaningful, taking care of patients, right? So we take all walks of life, but what we're really trying to share with people is you don't have to be an A student, but you have to be somebody that's willing to take a step back from your personal obligations to be in a program like this.
Yeah, that's a great point.
We do recommend that people don't work. No work.
This is your job.
Yeah,
this is your school and your job.
Yeah, we say yes to you and you say yes to us. It's all you're going to be doing for 11 straight months.
Yeah. All right. I think that paints a really good picture of, like you said, you don't have to be an A student to kind of go through this program, but your level of commitment has to be there because it is going to be intense and accelerated to kind of go through it. Brenda, you mentioned that there's a lot of demand for this position right now. And in fact, I think you shared something with me last time we spoke that I'm wondering if you could let folks know about students who hadn't even become certified surgical technologists moving through their cohort last time were all offered full-time positions before they were even done with their program. Is that correct?
So yeah, that's correct. And I'll just expound on that a little bit. I mean, it's not just the last cohort. So the last cohort we graduated was August, right? Is that right, Lynn? We had a nice class in August, right? And we were back from COVID and it was a big celebration. We had a wonderful graduation ceremony. But those students in particular all had jobs. I mean, there were 2 or 3 people, Lynn, that had a job even before they were really into their clinicals, right?
They all had, so they all had jobs so they graduated in August. So most of them had job offers, multiple job offers by mid-July. And we also had one student who was offered a position in May.
Right.
And so basically they waited for this particular student to graduate, but they really wanted this student to work with them. So they held a spot for her until she graduated in August.
Yeah. And I could say, with all certainty, because we are small enough, like we only take about 20 or 22 people every 6 months. So we are able to get to know our students very, very well. So it's very easy for us to recall this information. Every cohort has experienced similar, maybe not 2 or 3 months in advance of graduating, but certainly we have close to 100% employment placement with all of our graduates. And that's just because the demand for a certified surg tech is so great, not just here in Maine, but all of Northern New England and the country, everywhere.
Right.
Yeah, so that's a good point. Healthcare is seeing no end in sight to kind of the workforce shortages. So this is a really good time for students to be considering a career in healthcare that's going to give them some long-term stability moving forward, just with what we're seeing. Now, could you talk about just briefly, if once obviously you could go from CST to nursing, are there any other career ladder tracks that students could consider from kind of becoming a CST and moving on from there?
Sure. You could go into radiology. You could become a PA. You can remain as a CST, but become a first assist, which is someone who assists the surgeon even deeper in terms of actually putting on sutures, cutting tissue, something a little more involved, you can go to medical school. You can become a PA. So there's lots of different ways to track. You don't have to go from a CST to a nursing position. There's lots of opportunities for you to move on and do something different.
Great. And then I think maybe what we could do now is we never really got quite into the application process piece of, how we talked about this is a year-long program. You'll spend the first 6 months in the classroom at Southern Maine Community College. That's kind of where the affiliate classroom is. And Brenda, that's Monday through Friday, pretty much from 8 to 3. You can expect to be in the classroom for those first half.
That's correct.
And great. And then the second 6 months is the clinical time where you're actually going out and rotating through the different sites and actually being in the OR.
Yeah, you're scrubbed in at the affiliates that we have, and there's an eye surgeon and a plastic surgeon and a dental surgeon, and then Maine General up in Augusta. We send students there, down to Southern Maine Healthcare in Biddeford, which is a MaineHealth entity itself. A lot of time at Bromhall, so you're exposed to the vascular surgery, the orthopedic surgery, the lung surgery, open heart surgery, brain surgery, the whole thing, like car accidents, that sort of stuff. And then some day surgery things that are within the MaineHealth footprint. But it's a different experience, all with the expectation that you're still studying a lot every night to prepare for usually a major exam a week, Lynn, we're giving our senior students?
For the senior semester, which is the second 6 months, you have one exam every 3 weeks.
Okay.
The study guides that we provide for those exams vary anywhere between 250 to about 425 questions, and the tests are about 33 questions each. You have you can fail one of those tests within that 6 month time frame. If you fail a second test, that would be considered separation. You'll no longer be in the program.
It's fast, it's accelerated.
No, that's helpful. And Brenda, could you talk about the application process too? So just what that looks like and what students would have to submit.
So applying to Maine Medical Center School of Surgical Technology is actually easier in a lot of ways than applying to a college, right? So we have our own admissions process, our own application. We're asking you for 5 references, 3 character references and 2 work references. We'd like to see all of your transcripts because the more grades you can provide us, the better we'll be able to walk you through what the expectations are going to be specifically. We like to customize the experience. So if you were a great student, wonderful, but it's still going to be really challenging for you. If you weren't such a great student, that's great too. But we will talk at length in a faculty interview about what tools are we going to be able to implement to make sure that you're able to get through that 4 to 5 hours of medical reading basically every night for the first 6 months of the program. I will mention in that second semester, to add on to what Lynn said, we do bring our students back to SMCC at least once a week, specifically to prepare to pass the national certification exam. So we are looking for you to go to work immediately and to have that medical credential. So we do bring you back and we stay in touch with you. You're in touch with all your instructors throughout to get you to that place where you're going to be successful and be able to take the job. But the application, there's not a lot to talk about. Go to my website or you can email me directly. I will send you information on how to study for the entrance exam. The application speaks for itself. We require the high school transcript. And then if you have any college or secondary education or certificates, we'd like to have the grades for those as well. We'll vet all through that, be in touch with your references. And once you have a complete application packet, we can talk about whether a person qualifies for a faculty interview or not. After a faculty interview, it could be anywhere from 1 to 3 weeks before you hear from us as far as acceptance into the next cohort. And we go every March and every September with a group of about 20 to 22 people.
That's really helpful. And just so everyone knows, I am going to send a recap email with kind of links to Brenda's website, which is extremely thorough and lists everything that she just talked about, what students would need to submit. And I'm also available to meet with you and your specialists if any students are interested in kind of having a more in-depth conversation. So if folks have like 2 minutes to stay on, we do have one question that came in from, I know we're close to time, but one of the students asked, since you see a lot of intense things in the OR, does your employer provide support or help through that either after the fact?
Yeah, so sometimes what will happen is, so generally speaking, what we do is we have this thing that we call a briefing. So we brief before the procedure starts. We talk about like things that we might expect or things that we're kind of keeping an eye on. And then at the end of the procedure, we have something that's called a debriefing. We kind of talk about like what happened, what went well, what didn't go well, what do we need to improve upon. In a situation where we're dealing with something that's fairly significant, that maybe wasn't an expected end result, there are people available that you can talk to. You can talk to your coworkers about it. You could talk to your clinical leader about it. You can talk to the operating room director. There's always people available to talk to when things like that happen. And actually, Maine Medical Center, MaineHealth actually provides opportunities for employees to talk to people about just about anything. So whether it's something that you've seen at work in terms of like working in the OR, or just something that you're dealing with on a personal level, stuff like that's always offered by MaineHealth, which is something that everyone should be taking advantage of.
That's great. Thank you, Lynn. And it's one of the things that we talk about, because this is not just about the training programs, but what it means to work for MaineHealth too. So what kind of benefits do they provide to their employees? And that's really good to hear that that's something that they take seriously. So with that, we're 1 minute over. I just want to say thank you so much to both of you, Brenda and Lynn, for sharing both your perspectives and experience with students on this call right now. And then just to reiterate that I will be sending a follow-up email. If you have 2 minutes to answer the survey that pops up at the end, we'd greatly appreciate the feedback. And join us next time when we talk about phlebotomy in December. So yeah, super exciting. Thank you everybody for being here and participating.
Thank you, Rachel.
Thank you.
Have a good rest of the day, everybody.
Take care.